Welcome.
Christina Romero on behalf of Planned Parenthood Affiliates of California, representing over 1,100 health centers in California, serving some of the same constituents and Californians through FPACT and Medi-Cal as this bill is serving in strong support.
Thank you so much.
Good afternoon. Noreen Farrell, Executive Director of Equal Rights Advocates, in strong support of SB 23. Thank you for your leadership.
Thank you. Good afternoon.
Good afternoon. My name is Jacqueline Chang. I am 16 years old, and on behalf of my school, Sacred Heart Prep, I want to show we strongly support this bill. Thank you.
Great, and thank you so much for being here. Welcome.
Hi. Catherine Kimmel with Bay Area Legal Aid in Oakland, California. The repeal of the maximum family grant rule would help my clients by increasing their and their children's economic stability, so I encourage you to vote aye on SB 23.
Thank you. Welcome.
Good afternoon, Steven Sepulveda. On behalf of the California Immigrant Policy Center, we are in strong support of this bill.
It's good to see you.
Thank you.
Good afternoon. I'm Shauna Heckert. I'm the Executive Director of Women's Health Specialists. We're feminist women's health centers that have been on the face of the earth for 40 years. We provide health care to women no matter what their economic status is, and have been proud to see women that are on welfare or not. And we provide reproductive health and birth control. And I can tell you, as a provider for 40 years, that women are preoccupied with controlling their fertility.
Hello.
And to say anything else but women are the most responsible members of our society is an insult. And we are obviously in strong support of this bill, and we have been for all the years that the senator has brought this forward, and hope for your support today. Thank you.
Thank you so much. Good afternoon.
Good afternoon, Chair and members. Kathy Mossberg, representing both the California Family Health Council, so Title X federally funded family planning clinics around the state, as well as the California Association of Food Banks, both organizations in support.
Thank you.
Good afternoon. I'm Sandra Poole, Deputy Director of the California Black Health Network. We strongly support this bill and ask that you make 2015 the year that we repeal this archaic law.
Thank you so much. Welcome.
Good afternoon. My name is Elizabeth Castaneda. I'm with Act for Women and Girls. I am a Cal Aid recipient, and I really support this bill.
Thank you. Welcome.
My name is Erin Garner-Ford. I'm here on behalf of Act for Women and Girls. We're located in Tulare County, and we are here to tell you that we strongly urge you to support this bill.
Thank you. Thanks for making the drive.
Hi, I'm Sarah Hutchinson, also with Act for Women and Girls out of Tulare County, and I'm also a resident of Fresno County, and I strongly support this bill. Thank you.
Thank you. Welcome.
Good afternoon, Ashley Morris on behalf of the ACLU of California. We're very, very proud to sponsor SB 23. We thank Senator Mitchell for her leadership and urge your aye vote.
Thank you.
Good afternoon, everyone. My name is Sierra Harris. I'm the Assistant Director of Access Women's Health Justice based in Oakland. We serve around 600 women and families every year who are seeking reproductive health services across the state. And for all of the reproductive justice issues that Ms. Adams outlined, we are proud co-sponsors and urge your aye vote.
Thanks. Good afternoon.
Good afternoon. Hello. My name is Sage Coram. I volunteer at Access Women's Health Justice and live in Oakland. I strongly support this bill and ask for you to support it as well. Thank you.
Thank you. Welcome.
Eileen Schnittger with Women's Health Specialists, Feminist Women's Health Centers of California. And on behalf of our 50,000 clients, women that we see every year in Chico, Redding, Sacramento, and Santa Rosa, we work tirelessly for reproductive justice and against reproductive coercion. So thank you, Senator. Thank you so much, Senator Mitchell. And the cat's out of the bag, thanks to the last two works of your leadership and those in the room. And so there's no reason to continue. Thank you.
Thank you so much.
In favor.
Thank you. Welcome.
I'm Jenya Cassidy, California Work and Family Coalition, in strong support.
Thank you so much. Good afternoon.
Julia Parrish, representing the Legal Aid Society Employment Law Center, and we are in very strong support. Thank you.
Thank you.
Linda Warner with the California Catholic Conference, in very strong support.
Thank you so much. Good afternoon.
Jim Lindberg, on behalf of the Friends Committee on Legislation of California, we're in strong support of this bill.
Thank you. Welcome.
Hi, my name is Jamie Salyers, and I was previously an MFG recipient. I was in a really horrible marriage, and I got stuck in that during the recession, and no one wants to be in that situation at all. And we're not just people that don't want to go to work or have no ambition. I work 60 hours a week to take care of my 3 children, and I think I have a lot of work ethic, I have a lot of drive, and it's just not a situation people volunteer for, and it's definitely not for monetary purpose. So, thank you.
It means a lot that you'd be here today. Thank you so much. Thank you.
Kimberly Chen on behalf of the California Pan-Ethnic Health Network, also in strong support.
Thank you so much.
Hello, my name is Erica Diaz. I'm a junior in high school, and I'm a program member from Act for Women and Girls, and I urge you to support this measure.
Where do you go to high school?
Woodlake High School
All
in
right.
Tulare County.
Hey, there we go. Thank you.
Good afternoon. My name is Emily Caruso, representing the California Alternative Payment Program Association, wishing our strong support on this measure. Thank you so much for your time to discuss this really important issue today.
Thanks for being here. Welcome.
Hi, I'm Courtney Weber. I work at the East Bay Community Law Center, and again, thank you for your time. We strongly support this bill.
Thank you so much. Come on up. How you doing?
Hello.
Who's this?
This is Cameron.
Cameron, what's going on?
My name is Sherelle Shaw, and I receive CalWorks, and I have a 5-children household, but CalWorks only gives me for my 2 kids, and I have twins, and I knew about the MFG grant, and I kind of took off. I asked the county to stop my aid so that, I knew I was gonna have twins, and then so the county didn't stop it, and it was 2 months, but it wasn't consecutively. So my twins were barred from the MFG rule, and it's been really hard to provide for them and take care of them. I'm a working and training parent. I'm training to be a school bus driver. And just without the grant for the twins, it's been really hard for diapers and stuff. So I've been getting support from family members and things, but it's really needed. It's really needed, and I think that I don't know. I'm nervous.
You're doing a great job.
Sorry, but yeah. So I don't receive it for the twins, but the resources is little, and I need. It's needed. I don't know what else to say.
No, hey, you did a great job. Thank you so much. Really good to see you in Cameron. Thank you. Welcome.
Hi, my name is Luann Nguyen. Our organization, the East Bay Community Law Center, has been working on this for 9 years, and it's the bill that we have invested the most attention and focus on. When we talk to administrators in other states about this policy, especially the ones that have repealed the policy, we asked them, why did you all do that? And they said that they did that because the policy doesn't work. It's really burdensome to implement, and it takes away resources that could be spent on other things, including resources to help family participate in work and get off of public benefits. There is something to abject poverty, to extreme poverty, that makes it harder for people to move forward and get out of the welfare system. And that's what happened with Sherelle. Not having transportation, not having diapers, and I think Sherelle will be okay with me sharing this, and having to go to Walmart to steal your diapers because your kid don't have it puts you in a situation where you get criminalized for the poverty that you are in, and it makes it so maybe you can't be there for your kids, and maybe the system has to be there for your kids. So we have to think about how poverty impacts children, and it impacts the system as a whole, and people's participation in this program. Thank you.
Thank you so much.
Good afternoon. Kevin Aslan, Coalition of California Welfare Rights Organizations. The MFG rule has been a big part of the fact that California sadly leads the nation in child poverty and the supplemental poverty level. And hopefully this could rectify that in part. Thank you.
Thank you so much.
Destiny Montes with Act for Women and Girls. I'm a sophomore in high school and I strongly support this bill.
Where do you go to high school?
Yes.
No, where?
Oh, Mount Whitney.
Right on. Thank you so much. Thank you for being here. How you doing?
Oh, good. Hello, my name is Zulema Donata. I'm a senior at Woodlake High School, which is located in Tulare County, and I am in a committee called SHAPE, which is for Act for Women and Girls, and I strongly support this bill.
Thank you so much for being here.
Hello, Jessica Reynoso from Act for Women and Girls, and I am a junior in Woodlake High School, and I support this bill.
Grateful you're here. Thank you.
Hi, my name is Giovanna Renteria. I'm a senior at Redwood High School located in Tulare County, and I am a part of a program that Act for Women and Girls runs, and I completely support this bill.
Thank you so much. Welcome.
Hi, I'm actually a teen mom. I'm parenting a 2-year-old. My name's Katrina Flores, and I'm 19, and I'm actually in the ACT program too from Visalia, California, and I strongly support this bill.
Thank you for being here. All right. Thank you so much for all of your testimony. We're very grateful. I do need to ask, though, if there are any individuals here today that would like to be able to speak in opposition of the bill today. And if there are, to please come forward now. And I do think that about 2/3 of the room is going to leave here in just a bit. I would like to be able to offer the senator any closing remarks.
I appreciate that, Senator. First of all, I'd like to thank all those who have tracked this issue and are here today to support the bill. I'd like to thank the representatives from local government. I think that speaks volumes to the practicality in terms of even the core administration of the measure. I'd like to thank California Welfare Directors Association, Western Center Law and Poverty, who've made this a top priority for several years. Clearly, it's a very emotional issue. It's a very personal issue for many of the people in the room. And I think it's important that we acknowledge that the premise that guides the continuation of this policy is really based on a number of outdated myths and flawed assumptions. That families receiving aid purposefully have babies to get more money. That families can continue to receive aid indefinitely. That poor families don't want to join the workforce and therefore have more babies so they don't have to. And that it's the state's place to determine the number of children a family can be allowed to have. I would argue, members, that these assumptions could not be further from the truth. And quite frankly, I'm ashamed that we have enshrined in law a statute that perpetrates these horrible myths. I just would say, further in closing, the irony. I recall reading the Sacramento Bee when this bill was signed into law, and in the same issue on the cover of the paper was the article about one of the first families that had multiples. I think they had 5 or 6 babies at one time. And the nation opened our hearts and pocketbooks to supporting these families, and we were purchasing houses and minivans, and college scholarships were afforded. And I wrote my first letter to the editor, to the Sacramento Bee, and I said, I guess the argument is women should have all their babies at one time, because under maximum family grant, they're going to be penalized for having additional babies, but if you have 6 babies at once, it must be okay. I just found that ironic that in one situation we could support families, and in another situation we could not only not support them, but pass such a harmful anti-woman policy as California did at that time. As many witnesses have said, a number of states have reversed the policy for very practical reasons. It does not work, and I hope California will be counted amongst those very soon with the passage of SB 23. I ask for your aye vote.
Thank you so much, Senator. I did hear a motion by Senator Liu to pass this to the Appropriations Committee, I believe. Yes, thank you so much. If we can please go to a roll call vote. Mr. Teamer.
McGuire.
Aye.
McGuire, aye. Berryhill. Hancock. Aye. Hancock, aye. Liu. Liu, aye. Wen. Aye. Wen, aye.
We have a 401. So thank you so much, and do appreciate all the hard work that went into today, and grateful for your advocacy. And I'm sure if there are individuals that may want to co-author, to please contact Senator Mitchell's office, correct?
Absolutely. I thank the committee for your patience and your time.
Okay, thank you so much.
Some of us have been co-authors. Senator McGuire.
I think everybody's, yeah, all right.
Senator Wolk has a fantastic bill coming forward. You're welcome to stick around. Okay, there we go. Senator Wolk, if it's okay, we'll just wait for the room to clear out just a bit.
Hello, Jim. How are you?
Dan just called me, but I didn't take the call.
Oh, okay. You probably should.
I left him a message back saying that I was with you, so I could talk.
How are things?
All right, ladies and gentlemen, thank you so much for your patience, and we are honored that Senator Wolk is here today. She has Senate Bill 174, focusing on a study on crisis nurseries. The floor is yours, Senator.
Thank you, Mr. Chair. Members, in California in 2013, there were 81,000 substantiated cases of child abuse, and over half of those cases involved children ages birth to 5. We know how important how significant these experiences are in creating lifelong negative impacts. The estimated national average lifetime cost per victim of non-fatal child maltreatment is $210,000 in 2010 dollars. In 2004, the legislature established a separate licensing category to provide temporary shelter for children who are at risk of abuse. We call these shelters crisis nurseries. The mission is to provide a free, temporary, safe, voluntary placement for children while a parent or guardian is undergoing a temporary financial, health, or other challenge. In 2006, the ARCH, Access to Respite Care and Help, National Respite Network and Resource Center, published the results of a 2-year study examining the relationships between crisis respite care to incidents of reported child abuse. The evaluation also explored the differences in outcomes between crisis respite, used as a secondary prevention service, and as a tertiary prevention service. The evaluation was conducted from 2004 until 2006 and included the 2 Sacramento crisis nurseries, which are located north and south in Sacramento, and the Yolo Crisis Nursery. There are 5 in the state, and I think there actually were 6 at one time. The study provided evidence that Child Protective Services reports on target families were significantly less likely to be substantiated than CPS reports on comparison families without crisis respite. Families receiving respite crisis resolution services were 50% less likely to experience substantiation by CPS than those who utilized crisis respite with previous CPS involvement. Over 3 times less likely for those families who utilize crisis services. When parents access the crisis nursery, they're connected immediately with wraparound services that support them in the longer term. Internal studies have shown that these supports and intervention keep the kids safe and out of longer-term care. In 2010 and 2012, the legislature again debated and approved crisis nurseries by limiting their use by counties for foster placement, and then by removing the legislative sunset which existed, allowing crisis nurseries to exist in perpetuity. Today, I come before you to ask for your support of SB 174 to authorize a study to measure the value for crisis nurseries in monetary terms. Those who run the nursery will tell you that although the cost to serve children is fairly high, the cost savings when children are kept with their families is much higher. But before we can hope to grow the model in California and expand the use of nurseries, we truly have to understand their actual value. With me today is Jim Provenza, who is Yolo County Supervisor, and Roy Alexander, who's with the Sacramento Children's Home. I ask for your aye vote.
Thank you so much, Senator. Supervisor, we're grateful that you're here, and you have the floor.
Thank you very much. It's good to be here. Yolo County Board of Supervisors is very supportive of crisis nurseries. It really is a tool to avoid children from having to go through the Child Protective Citizen and be placed in protective care. It's successful because just like any family who have a support system can rely on someone else when they're in a crisis, a grandmother, an aunt, or an uncle. There's many families that don't have that support system, and the Crisis Center offers that. If a parent becomes sick, if there's a crisis in the family, if there's a significant high degree of tension, the Crisis Nursery is there. In addition to that, it's able to serve very high-need children, children who need child care and really the preschool experience, but who really would not make it and do not make it in any other child care experience, either because of a disability, a crisis in the family, or some trauma that they've experienced. The Crisis Nursery works with the child and with the family to avoid that situation, and they have been 97% effective in those placements at avoiding further CPS involvement. They work in conjunction with the foster care placement program for those children who are placed in foster care. They provide daycare and respite for the foster family. One of the problems you have in recruiting foster parents is, say you have a very difficult child to place, say a child suffering from fetal alcohol syndrome, and you have two foster parents who have agreed to take care of that child, but they're both working. It's going to take them time to set up childcare and to make other arrangements. This allows for up to 30 days of assistance from the Crisis Nursery so that foster care experience can work. It's working for us. Our foster care program is more successful than other programs, and we have more success in placing children locally than we've ever had in the past. Very excited about a pilot project to demonstrate the success, and hopefully see other people use this preventative tool.
Supervisor, we really appreciate your perspective, particularly on the on-the-ground level on what you've seen in your county, so thank you so much.
You're welcome.
Really grateful you're here. Thank you. Please, sir.
Hi, I'm Roy Alexander. I'm CEO of the Sacramento Children's Home. We operate a crisis nursery both in North Sacramento and South Sacramento. We're anxious to officially demonstrate and record our successes and our ability to keep children out of the Child Protective Services system, and particularly out of the out-of-home placement system. We know from previous research and our daily anecdotal evidence that we are very successful. The families tell us so. Many of our families tell us that without our assistance, they would have had no other recourse other than to relinquish the children to the foster care system. Where we hear that the most often is when grandparents become parents, and all of a sudden they have 5 children in their home, and they're in their 70s or early 80s, and they don't have the ability to withstand the pressures of that, and they use the crisis nurseries and our family resource centers as a way to support them and keep that family together. Thank you very much.
Thank you so much, Mr. Alexander. And if it works, I think that hearing from the Vice Chair, I think we're comfortable on this side. All right, thank you so much. I want to see if there's any questions or comments for the Senator on the left.
Oh, I do have just a quick comment.
Oh, please.
I'd like to hear a comment from the Senator. Yeah, I'm going to support this bill today, but in my opinion, I think this bill hardly needs, or this issue hardly needs a study. I'm curious, did we run this same bill last year?
Yes, at the last minute.
So was it gut and amend last year, so it got held up in the probes?
Yes.
Because of the cost, or?
Yes.
So what's different this year?
Well, the counties are going to provide funding, or there will be a requirement for half the cost of the project would be other sources. This came about at the last minute, and it's really hard to do budgets at the last minute. That's the
Keep
issue.
that in mind again this next year, Senator.
Despite what you may think, you really do have to plan ahead.
Well, then we're mandating again to a certain extent that the counties come up with part of this payment.
There needs to be some, yes, private funding.
All right, thank you.
Thank you very much, Mr. Vice Chair. All right. Would like to be able to see if there are any others in this room that would like to come up and speak in support. And if you could just please state your first and last in your organization.
Hi, I'm Leslie Medina. I am the administrator of the YOLO Crisis Nursery, and I am in support of this. The Crisis Nursery is there for the community, and on a weekly basis, I hear stories of how we are saving not only children's but mothers' lives and an ability to connect them with the community and allow for them to be get their life together, to be able to hold their family together. And when you look at it as a child, last 2 Friday nights ago, a community member saw a mother struggling in a parking lot of one of the grocery stores in Yolo County, and the community member knew to call the crisis nursery. And the mother was claiming to want to kill her child. And the crisis nursery was able to take in that child and is now helping that family by connecting them into community resources to get back on their feet, and they have the child safe. So just the fact that even the community response and the community involvement in a place like that to save our children and keep our communities thriving is enough for this to keep going, I think.
Thank you. And we're really grateful you're here. Thank you so much. Welcome.
Hello, thank you. My name is Becky Hurd. I'm president of the board of the Yolo Crisis Nursery. I've been involved with the nursery for 14 years. I began when it opened its doors as a volunteer. I've continued to volunteer and remain active. And now we have a board of directors that is actually effectively running the nursery. What I'd like to say to you, I think there's 2 ingredients for success for our California crisis nurseries that are really profound. The first is our wraparound services. We bring parents into the nursery, and a caseworker takes so much time to really identify what their needs are and then to meet those needs. The second part that I see that makes a really incredible difference is that the parents are required, through whatever services they are seeking, to resolve their crisis or their situation. They're required to see that child on a daily basis, to come to the nursery, to visit with that child, to let that child know everything is going to be all right. And in 97% of the cases, they are all right. It works. And you ask, why do we need a study to determine the efficacy? I would say it's so that we can use this program as a role model across the nation. It does work, but you can't prove it works until you've actually managed a study. And I think that I support Senator Wolk wholeheartedly. I thank her for her work on this bill and could not support it more seriously. Thank you so much for considering.
Oh, thank you for being here. Anyone else would like to come and speak in support? Thank you. At this time, we'd like to see if there are any individuals that would like to be able to speak in opposition of the legislation. Let's bring it back. Senator, thank you so much for all of your work. I know that you have some closing comments, and I just want to confirm that you've taken the amendments as well.
Yes, I have.
Well, thank you so much.
Thank you for reminding me.
And any closing remarks?
Just ask for your aye vote. Thank you.
Really, again, grateful for all of your commitment on this issue. And Supervisor, you're very lucky to have her as a senator. My goodness.
I'm lucky to have you.
Hey, there we go. My goodness.
Mutual like.
Why don't we go to Mr. Teamer for a roll call vote, please?
McGuire?
Aye.
McGuire, aye. Berryhill? Aye. Berryhill, aye. Hancock? Aye. Hancock, aye. Liu? Aye. Liu, aye. Nguyen? Aye. Nguyen, aye.
Thank you. Thank you very much.
Thank you. Thank you. That passes unanimously. We are going to be passing that as amended to the Appropriations Committee. Thank you so much, Senator and Mr. Supervisor. We are now honored to be able to have Senator Bell here. Senator Bell has been busy today. He is actually coming to us from a joint hearing with Energy, and he's also chair of Transportation and Housing. Senate Bill 12 is focused on foster youth, and do want to say thank you to the senator for really being a leading voice in the Senate on behalf of foster youth. And we're grateful that you're able to dart out of your previous committee to be here with us today. Welcome, Senator Bell. You have the floor.
Thank you, Mr. Chairman, members. That's the first time anybody said that I darted anywhere. I think that's kind of, I'm kind of not equipped to be darting places, you know. So, yeah, I don't know if I moved that quickly. Anyway, I'd like to thank the committee and the staff for their hard work on this important legislation. And we have amendments we've accepted, and they've been reflected in the analysis. And also there's a sort of an updated mock-up that corrected the amendments that were in the staff report, that we made some technical change to the amendments that were in the report. And we accept those as author's amendments. The amendments narrow the population of the crossover and probationary youth that would be eligible for extended foster care benefits. I'm going to be brief in my remarks to allow more time for the witnesses. In 2010, the legislature passed AB 12 because youth who are forced to leave their foster care system at age 18 face significant challenges such as high rate of homelessness, incarceration, reliance on public assistance, and low rates of high school and post-secondary graduation. Currently, some foster youths who are crossover into the juvenile justice system are not receiving their benefits when they exit the juvenile hall or camps. This is happening because their placement order for extended benefits essentially disappears when they cross over. This AB 12 inadvertently left the most vulnerable of our youth out, and SB 12 actuates the intent of AB 12 and ensures that no foster youth is left behind. I respectfully request your aye vote. I believe this bill will help those foster youth that we intended to help with AB 12. Thank you. I have witnesses.
No, thank you so much. And again, truly mean this. You really have been so focused on foster youth. Thank you very much for your work. Would like to be able to open it up.
Sure, thank you. Good afternoon. My name's Angie Schwartz. I'm the policy director with the Alliance for Children's Rights. And as Mr. Bell noted, in 2010, due to Mr. Bell's leadership, California became one of the first among the states to take up the federal option of extending foster care until the age of 21. And that was known as AB 12, or California's Fostering Connections to Success Act. And that law has been a resounding success in this state. Thousands of young people have benefited from the protections of AB 12. And we at the Alliance provide direct legal services to transition-aged youth. So we actually see that every day as our attorneys help countless young people who would otherwise have been homeless avoid homelessness and actually get to pursue their educational and vocational goals. Unfortunately, as Mr. Bell noted, we've also seen young people slip through the cracks. Like the youth who have the misfortune of being in a juvenile detention facility on their 18th birthday. That's because as current law stands, in order to be able to be protected by extended foster care, you have to have an order for foster care placement on your 18th birthday. And what that means is young people who are in a juvenile hall or in a camp or in probation, in some kind of secure confinement, they miss out on that opportunity because they don't have that order on their 18th birthday. Similarly, young people who were in our foster care system and end up in probation, and the court says you can't be returned to the home of a parent because it's not safe for you to go to the home of a parent, often release to a relative instead of placing with that relative. And it sounds like a small distinction, but the difference between a release versus a placement order actually makes all the difference for these young people in accessing extended foster care. So we see this every day. We have a client, Mark, who actually came into foster care at the age of 2. And he never found a permanent home. He had fetal alcohol syndrome and didn't get access to the mental health services he needed or the educational advocacy that he needed. He had an IEP, but he really never was able to benefit from school. And at age 17, he made a mistake, and he ended up in probation, and he was in camp on his 18th birthday. He spent his entire life in foster care, but because of that one mistake before he turned 18, he missed out on the protections of extended foster care. And when he exited that camp, he exited to homelessness and spent the next 2 years bouncing between homelessness and jail and homelessness again. SB 12 would have protected Mark and then the other vulnerable youth like him. It's actually a very small population of young people who cross over to our juvenile probation system, but they're a very vulnerable population of young people. When they're supported, they can become productive members of our society, and SB 12 will provide them that level of support. We urge your aye vote.
Thank you so much, Ms. Schwartz, and do appreciate your testimony, and we welcome you. If you could just please state your first and last and your organization.
Yes, my name is Catherine McCullough. I'm representing the Youth Law Center. I'm a legal fellow there. As Angie and the Senator just mentioned, youth who are forced to exit the foster care system at age 18 do face some really severe challenges, including negative outcomes such as increased rates of incarceration, homelessness, and unemployment. And because of this research and what we knew in 2010, Fostering Connections was passed to help combat those outcomes. And it really has helped combat those outcomes. But as just mentioned, some youth were left out of that, the transition services that AB 12 provided, and those youth include youth who cross over from the dependency system to the delinquency system, and youth who enter the foster care system through the probation door and never reunify with their parents. So I'm going to speak about both those populations for a little bit, even though they were covered by Angie. Thank you. Crossover youth are actually even more vulnerable than the population I just spoke of, even more vulnerable than foster youth. They're twice as likely, just foster youth, they're twice as likely to be incarcerated, twice as likely to be unemployed, twice as likely to end up homeless. They're extremely vulnerable foster youth. And actually, research has shown that the child welfare system creates the conditions that make it more likely for these youth to cross over. A youth who is placed in a group home is twice as likely to cross over into the delinquency system. Youth who reside with their biological parents aren't deprived the support and services of their parents just because they end up in delinquency. And for the same reason, we should not deprive foster youth who cross over into the delinquency system of the support of the child welfare system. Now, the other population of youth who enter the child welfare system through the probation door are foster youth, really. I wanted to give an example of a story I've heard. Johnny entered the delinquency system. Johnny's not the real name. Entered the delinquency system and was placed in a group home. His mother was addicted to methamphetamine, and his father was just not in the picture. He ended up being successful in the group home, and just as Angie said, there's a distinction between being released and continuing a placement order. The judge decided to just release him to his grandma, who was impoverished and really couldn't help support Johnny transition to adulthood. Johnny ended up in a homeless shelter and without the support of the child welfare system. And that's what we're hearing time and time again through legal aid, is that these kids end up in the homeless shelter, really not where they're supposed to be. These are foster youth. So we really need to start, applying AB 12 benefits to them and supporting these youth. And that's why we encourage your I vote today. Thank you.
Thank you so much. I know that we have some individuals that would like to be able to speak in support, and then if it's okay with the committee, why don't we do this, ma'am? Let's just open it up here real quick in regards to questions or comments from committee members, and then we'll go to support and or any of those that are opposed. Please, Mr. Vice Chair.
I just want to thank the senator for bringing this forward. And I vote myself and Emerson, I believe, back in the day. And this is a good fix to the bill of what we backed years ago. So I'll be voting for it today, and thank you for bringing it forward. You've been a great champion for the foster kids, that's for sure.
Thank you so much, Mr. Vice Chair. Senators, any other questions or comments? All right. All right. Hey, there we go.
Senator Berryhill said it well.
Hey.
Move the bill at the appropriate time, Mr. Chairman.
Yeah, thank you so much. We do have a motion on the floor. We'd like to be able to open it up for folks that are in support. And welcome. Thank you for being here.
Kim Lewis, representing the California Coalition for Youth, which operates a lot of the runaway and homeless youth shelters. Pleased to be in support. Thank you.
Thank you for being here. Good afternoon.
Rebecca Gonzalez, National Association of Social Workers, California chapter, in strong support. Thank you.
Good to see you. Thank you. You're all over the place today.
Khalif Asagai on behalf of Children's Defense Fund, California, in support.
Good to see you. Thank you. Welcome.
Sharon Riley on behalf of the Judicial Council. We do not have an official position yet, but we have been actively working with the author's office, the stakeholders, and the sponsor, and we anticipate having an official position soon. Thank you.
Thank you so much. It's good to see you. Anyone else who would like to speak in support of this legislation, please step forward. All right, we'd like to be able to see if there are any individuals here that would like to speak in opposition. All right, we're going to close it. We do have a motion. I do believe the Vice Chair's motion is to pass as amended to Senate Judiciary Committee.
Yeah.
All right. If we can have a roll call vote, Mr. Teamer.
McGuire.
Aye.
McGuire, aye. Berryhill. Aye. Berryhill, aye. Hancock. Aye. Hancock, aye. Liu. Aye. Liu, aye. Nguyen.
Aye, I'm sorry.
Nguyen, aye. 5.
Thank you so much. We do have a 5-0 vote in Mr. Bell.
Thank you.
Hey.
Thank you. It's a team effort. Thank you, everybody.
Thank you so much, Senator. We're grateful. Quick housekeeping. We do have 2 upcoming Human Services Committee dates, April 7th, and I want to say thank you to Yep. So we do have, I want to say thank you to Senator Liu, Senator Liu has last year so focused on aging and long-term care. We will be having a joint meeting coming up with the Assembly Aging and Long-Term Care Committee on April 7th, and really looking forward to hearing what the senator is bringing forward, because again, she's been an absolute champion for seniors. It's going to be coming up on April 7th. April 14th, we are going to have a bit of a different session for the committee. We are going to have a special order hearing on that day, focus on psychotropic drugs. This will be a follow-up to this committee's original hearing on psychotropic medication earlier this year. We will also hear some additional bills that day. So April 7th, again, thank you so much to Senator Liu, and then a special order hearing on the 14th. We have left the roll open for our first item of the day, and that was Senator Hall's SB 199. And Mr. Tamer.
Liu? Liu, aye. 5 votes.
5-0. Thank you so much. All right, without further ado, this meeting. Oh, and the rules. Hot dang. There we go. And let's roll to the rules. I'm going to have another piece of chocolate. How about a Twix? All right, here we go.
Senator Liu? Aye. Liu, aye. 5.
I was sweating that one. Hey, there we go. Again, thank you so much, everybody, for being here, and we'll see you on April 7th.